want to start by finding out how much all of you really know about what happens in the brain when we are happy. Jordan?
Well, I would say we know quite a bit, but I would also say it depends on what you mean by happiness. Because we understand the circuitry, the brain circuitry that underlies certain forms of positive emotion very well. We understand, for example, why people take drugs of abuse, and it's generally to activate those circuits. So I guess you could argue about whether or not that's happiness, but there's some forms of positive emotion that we really do understand. I think we know a lot about it, but I think most of it's been derived by people who study animals, not human beings. So for example, we know that you can make rats laugh by tickling them. So rats laugh ultrasonically if they're stimulated. They laugh when they're wrestling with one another, so they laugh when they're playing. We know that play is a primary positive emotional state, and that it's mediated by a particular kind of circuitry in the brains of mammals. We know that people and other mammals experience positive emotion when they're in the pursuit of important goals, and that there's evidence in the environment that those goals are being attained. And that's really an important fact, because what it means is that people think often of happiness as an outcome of success, let's say, but success-related happiness is a very short-term state, whereas the positive emotion that's associated with the pursuit of important goals can last for a tremendous amount of time. And that also indicates that without goals, the probability that you're going to experience positive emotion and happiness is virtually zero. And those are all really important things to know, and we understand the neurobiology of those things to a great degree. So,
how you deal with
well, there's
stress
two
and
things I
challenges.
wanted to say, and one is that people pursue things like the new job and the bigger car partly because they like to obtain status. And the reason they like to obtain status, at least in part, is because if you obtain status, brain levels of a chemical called serotonin go up. And if you have comparatively high levels of serotonin, which is what antidepressants produce, by the way, then you're much better at regulating your negative emotions. So when you're talking about happiness, you've got to get something clear too. Like, are you talking about the ability to regulate anxiety and pain, and anger, say the primary negative emotions, so you're content and satisfied? Or are you talking about increasing the probability that you're going to be in states of joy or interest or other forms of positive emotion that are more associated with the pursuit of goals? That's partly why definition is important before you start to ask the question about whether or not we understand the underlying neurobiology.
Sure.
You also have to treat acute suffering before you treat, say, lack of happiness. And the other thing too is that people who are brought to the attention of therapists are often not only unhappy, but they're having great difficulty with their social relationships. And so what's plaguing them, whether it's internal or external, is often socially disrupting. And so part of the reason that clinicians have concentrated on the alleviation of negative emotion is because you put the biggest fire out first. So it's not merely arbitrary. There's real logic behind it.
Is the neutral state of the brain happy, unhappy, nothing? What is it?
Neutral, generally speaking, is mildly exploratory, so mildly positive. So the brain generally is set up by default so that if your basic needs are met and you're satiated, you're going to be mildly curious about your surrounding. And the reason for that is that when everything else is going well, you might as well forage around and learn something. And that's a mildly positive state.
Okay.
Keep in mind that people differ temperamentally for biological reasons in their capacity to be happy at baseline. So for example, introverted people tend to be less happy. And the reason for that is that extroversion is associated primarily with activation of the underlying circuitry that's responsible for positive emotion. So extroverts, for example, have more activity in the left prefrontal part of the brain when they're in a resting state. And that's associated with approach system activation. The other thing that's really worth pointing out is that there's lots of pathologies associated with excessive positive emotion. So mania, for example, is a disease of positive emotion. And people who are possessed by positive emotion and who are overly optimistic gamble more, they're more likely to take drugs, they're more likely to look for short-term outcomes in economic games, so they bet heavily in the stock market and they're overly optimistic about it, and we've seen what that caused. So happiness has to be bounded and has to be operating within a system where things are optimally regulated. And it's not a goal, it's a side effect of the pursuit of of other goals.
So you want a distinction made between healthy happy and unhealthy happy.
Oh yeah, there's definitely cocaine. Like if you're on cocaine, that's unhealthy happy. And the reason people like cocaine is because cocaine directly activates the underlying circuitry that's responsible for positive emotion and approach behavior. So there's unhealthy pursuit of positive emotion, and drug abuse is a classic example. I probably believe more in the behavioral end of cognitive behavioral therapy. I think there's overwhelming evidence, for example, that if you expose people voluntarily to things that they're afraid of, that their fears decrease, and that's really an increase in courage fundamentally, and that generalizes. So I think that there's overwhelming evidence that if you help people develop a coherent and well-structured philosophy of life that sets out for them attainable and realistic and worthwhile goals, that their negative emotion is much better controlled, and they're much more likely to experience positive emotion.
I don't have to tell you, there were people watching this obviously tonight who will be saying, this is a lot of hooey what these guys are talking about. Come on, this can't be true.
Well,
what do you say?
The issue with regards to goals is obvious. I mean, you think about how people experience happiness in day-to-day existence. It's that everybody is always pursuing a goal of one sort or other, and if you encounter an obstacle, it makes you upset, and if you encounter something that facilitates your progress, it makes you happy. I mean, think of what happens to you when you're driving. You know, as soon as someone cuts you off, you instantly get a blast of negative emotion because they put an obstacle in your path. I mean, I don't think there's any debate about this. Like, stimuli, so to speak, that indicate that you're making progress produce positive emotions. As simple as that. And things that get in your way produce negative emotion. But also the corollary to that is that if you don't have goals, the probability that you'll experience positive emotion is very low, because there's almost always, most forms of positive emotion are experienced in relationship to a goal. So if you're incoherent in your personal philosophy, the probability that you'll experience more negative emotion than you want is almost 100%.
Will these replace antidepressants some days, these new techniques we're talking about tonight?
Well, someday is a long way off, and lots of things are going to change in the next 20 years, and I don't think there's any way of seeing the future. But I think that different situations call for different interventions. I mean, with some people, as the others have pointed out, their depression is so solidly locked in and they're in such an agitated state that being able to concentrate even long enough, or even being able to attend mindfulness sessions, is really out of the question. And those are people who are often at high risk for suicide. And you don't want to limit the options that are available to people who are suffering. The advantage to the mindfulness training is that it's a non-drug option, and because it involves learning, it's likely to be more permanent. And also the probability that it's going to produce negative side effects is very low, which is something you can't necessarily say about medication. So I don't think it's an either-or issue. I mean, people have a lot of problems, and it's because people are fragile, and every tool we have to address that is a worthwhile tool if it's used properly.